There is something to this patient engagement stuff. It is changing the nature of the interaction. If we can hook into it and learn how to do it effectively, we can really alter the nature of care delivery.
The idea of getting people involved in their care is really potentially the best idea for healthcare that we've come along with in a long time. The shift that needs to happen is we really need to look to the patient as one of the most informed and potentially the most important people at the table in terms of what our medical decisions are.
A healthcare revolution is underway, but it's not being driven by a breakthrough drug or policies coming out of Washington, D.C. It's being led by empowered patients who are taking ownership of their health.
Patients are rising. It's not hype. It's not a fad. It's an observable trend. They're becoming more engaged with their own healthcare. They're using social media to connect with each other. And as more patients become empowered patients, they'll get stronger and they will change the healthcare system itself.
At ePatient Connections, a diverse community of health communicators and marketers gather to explore innovative ways to reach and engage today's digital health consumers.
The idea was to do a conference that's much more applied than many of the other conferences out there. I love conferences that are visionary or futuristic or theoretical even. But at the end of the day, we wanted to make sure that we're giving people information and tools that they can put back to work. So we want to know, how do you get this done? What works? Does Twitter work? Does Facebook work? What's the right way to implement these tools? And it's not all social media. What are new ways to reach these empowered, digitally savvy patients?
Why Johnson & Johnson on YouTube? Why not is the question. There's a huge audience out there that's very hungry for healthcare information, and it's a great thing, I think, to position your company or your organization as a provider of that information.
During the event, more than 24 presenters shared experiences, case studies, and insights with more than 250 attendees.
We're all here today because we believe technology and innovation have a potential to revolutionize how we practice and deliver and consume healthcare.
The reason why is that people need to know more than just what they get from their doctor. The healthcare system can be very complicated.
This is about engaging the next generation of consumers, and we have to engage them on their turf.
So our second step was to go to some longer podcasts, again reusing content that we were already producing.
What we found with all of our social media activities is that you got to be yourself.
Our goal is to provide our health information when, where, and how people want it and need it to inform their healthy and safe decisions in their lives. There's so much potential, at the intersection of digital and health from all points of view, from the payers, from the providers, and from the patients certainly, and from other healthcare professionals. So I think that the more we can talk to each other, share great ideas, not have to start from scratch every time, but leverage other people's great ideas, the faster we can get to where we need to go.
Patient bloggers aren't writing because someone told us to. And we're not writing these blogs because we're paid by all these big companies. And basically, we're just out there writing because doing this helps us heal.
E-patients played an important role at the conference, with patient opinion leaders and patient advocates providing their perspectives about the right and the wrong ways to connect with patients.
Patients are sharing information with each other and finding information and bringing it to others completely off the grid. And business planners who don't recognize this are going to miss a major opportunity. It is not possible to understand swimming from outside the pool. Right? Jump in, get involved, and we're going to have to find out how it really works.
I think understanding others' perspectives and how we can all work together with empowered consumers is really important. I represent a patient community ourselves, and so it's really important for us to kind of understand how, for instance, the FDA fits into working with prospective sponsors for our organization.
On June 18th, the healthcare marketing world changed when you sent the first pharmaceutical branded tweet. Did you expect that that tweet was going to generate anything? You just thought, well, okay, I'll send this first branded tweet and that's it.
I think I actually made a comment on my personal tweet a month and a half later. I can't believe so much is written about 140 characters.
With a stated focus on connecting with digital health consumers, there was some debate over the role of life science companies when it comes to supporting people's health.
The criticism that it was just going to be industry-based, I'm pleasantly surprised to find that that's not necessarily true. There wasn't as much shameless self-corporate promotion as I anticipated there might be.
I'm in business myself. I have nothing against making money. I hope to make money. The question to me, the real important question, is whether there's duplicity. If people are straight up about what they're selling and what it's good for, and they're not concealing its risks and so on, that's great. I mean, that's what I needed to know about.
Keep me alive. That's what you're there for. I don't care how many page views your Facebook pages are getting. I want to be healthy, and it's your job to provide me with the tools to keep my health. So, but if you want to have a Facebook page, as long as your drug is up to, everything else is up to stuff, that comes first. My health comes first. I think everybody's quick to complain that pharma's not involved or marketing's not involved, and we don't hear enough from all sides of the issues. They have to start somewhere. So bringing us together in this room is as good a place as any to get the conversation started. I'm not sure where it'll go from here, but it has to start somewhere.
I think one of the problems with most conferences is you go to a one-day event or a two-day event and then it's over, and a lot of the connections you make, unless you actively try to keep those up, kind of go away after a while.
While ePatient Connections was successful in bringing health communicators and patients together, the conference organizers plan to keep the community alive beyond the event itself.
The idea is to spark a new community of healthcare communicators that don't talk often enough. We have people from life science industry, we have people from hospitals, we have people from public health institutions, and this all stems from a basic belief that pharmaceutical professionals can learn from what the Mayo Clinic is doing to reach patients. We think hospital marketers can learn from what the Center for Disease Control is doing, and we think public health educators can learn from a company like Johnson & Johnson. So let's bring the diverse group of community together. We might not always agree on the approach, but we can certainly share from best practices, what works and what doesn't. After all, as I like to say, I mean, we're all selling better health.